In the last video, we went over different types of growth. So, what is appositional growth? That is thickening. And what was endochondral ossification? Ossification from cartilage. And do you remember which type of cartilage? That's right, hyaline cartilage. And intramembranous was ossification from mesenchyme. So, what bones undergo intramembranous ossification? Only the skull bones. And actually, one of the skull bones does not, but most of the skull bones do. So, in endochondral ossification, bone starts out as hyaline cartilage. I just said that. I will ask that on the test. So, we're going to look at landmarks now. That's why I have the split screen. And the reason this is important is I'm going to talk about landmarks in the next two chapters. And I used to talk about them. I stopped because our semester went from 18 weeks to 16 weeks. And I discovered that cutting out this section was a horrible idea because students had no idea what these landmarks were when we got to the bones. So let us begin. Our first set of landmarks are articulating landmarks. That is, two bones will come together to form a joint. And there are condyles, facets, heads, and trochlea. We're going to start with a head right here. My workbench. This right here is the head of the femur. It is a nice single rounded structure. Now on the other end, we have a pair of structures. Those are not heads. Heads are always by themselves. So this is the head of the femur. This one is nice and large. Well, I have the ulna right here. Now over here, I have a rounded structure. That too is a head. This rounded structure right here is the head of the ulna. So a head is anything that is an articulating surface that is a single rounded projection on an epiphysis. It's articulating. So we have a nice socket right here. This is going to form a ball and socket joint. The head of the femur goes into the socket called the acetabulum, and left foot in, left foot out, and shake it all about. So heads are single round articulating landmarks. So a head is a single rounded epiphysis. So these are always at the ends too. Now, a condyle. It is a round, oval. It's smaller than a head. And all the condyles I know of come in pairs. So this is the other end. I'm not sure if you could see my mouse here, but these are condyles, 287 and 284. These are both condyles right here. So they are a paired structure, and they're actually going to hook up with the condyles of the tibia. So there's a condyle here, a condyle here. The tibia is a little bit confusing, but because of where the condyles are, but that's a condyle, and they're going to form a joint. So condyles always are in pair, and they face front or back usually. So this is the posterior part of the femur. Now we have a bone that thinks it's hilarious. We have a set of paired structures. These technically would be condyles. Unfortunately, they're different shapes, so I get to teach you different names for them. But technically, those would be condyles too. We're on this end. How many are there? It is a single round structure, so it is a head. Now over here, we have the occipital bone. 99 right there. Or I think it's a 66 actually. We have these paired rounded structures. Let's see if I can get a little bit better light. So paired rounded structures right there and right there. Those are condyles because there's two of them. They're rounded. On most other mammals, occipital bone would have them right here. Now, here is the radius. It has a single rounded structure. What would this be? That's right. That would be the head of the radius. The radius has a beautifully round head. So, we have talked about condyles. They come in pairs. Smooth, rounded oval structures that are small. A prominent single structure is a head. Now we have facets. So facets are these indentations in bones right there. So let us look at this bone in real life. So this is the atlas. He holds up the sky, not the world, the sky. So this is a facet. This is a facet. If I flip him to the other side, he has facets on both sides. So these are called articulating facets on this bone because they're going to articulate with another bone. So remember our occipital bone over here, these two paired condyles right here. I am so sorry, that's not in focus. Well, the facets would go right on top, and you could nod your head so they would articulate. I'm not doing a good job of articulating. Aha. So they articulate. So that is what a facet is. You have facets on vertebrae. You have facets on some other bones. So a facet, it's another articulating bone. Is a trochleella. There is one trochleella on a bone we're going to talk about. There are other trochlea in our bodies, but we're only going to talk about one in this class. A trochlea is something that's a pulley-like structure. Now, if I go over here, remember I said condyles are nice and round? This is a nice example of a condyle. That actually isn't. This looks like a pulley to me. My dad sailed boats. I had pulleys all over the place. I am surprised that if I look around his basement, I would not find a pulley, or 12. I think I actually tossed them all. But this would be a trochleella, where this is actually a true condyle. So, like I said, the humerus is not very funny. It's actually quite weird. So, what I'm going to do on the test is ask you, what are articulating landmarks and the difference between a head and a condyle? Now we have landmarks that touch muscles. The condyles, the heads, the trochleella, the facets, those are all for two bones coming together. These are where muscles or ligaments are going to attach. I guess I should say tendons or ligaments. So, a crest is the first one. A crest is a narrow, prominent, ridge-like projection. If you look at some skulls of carnivores, they have a humongous crest running right down their sagittal suture. We don't have that crest. Instead, our most prominent crest is right here on the ilium. This is the top of the ilium right here. That is the iliac crest. It's a very prominent, you can touch it on your hips. So that is the iliac crest right there. So a crest is a prominent structure that muscles attach to. Now the next one is an epicondyle. So we are going back to our femur. I like the femur. So what were these again? These are condyles. An epicondyle is a rounded projection on the side. So this is the epicondyle. This is the condyle. This is the condyle. This is the epicondyle. Muscles, tendons, and ligaments all attach here. That is our for articulation. If we look at the not-so-funny bone, it has a beautiful medial epicondyle right here. You can touch that on the medial side of your elbow. That is an epicondyle. On this side, that's the condyle. This would be the epicondyle. And we're going to learn this condyle is actually called the capitulum. So epicondyles are next to condyles. They are rounded structures. They face laterally, and they attach. A line is a low ridge. There are allegedly gluteal lines on that hip that I have, but since it is a model, they're not very good. A process is any sticky, bony process that sticks out. So we're going to go back to the ulna. Has some of my favorite processes. This is the head right here of the ulna. This thing right here, that's that little bone that's sticking out on the back of your wrist on the pinky side. That is a styloid process. This is actually a very sad styloid process. They're a lot cooler than that. This right here is the back of your elbow. Right here, that's the back of your ulna. That's the olecranon process. This right here, that is the coronoid process. So these are things that stick out. So here's our head. This is a bony landmark that is sticking out of the temporal bone here. That is called the mastoid process. And the pointy one right here is called the styloid process. This thing, it's sticking out of a bone. That is the zygomatic process. Ooh, this bone. It has things sticking out of it. This one and this one, those are all processes. We're going to learn that's the temporal and that's the frontal process. So a process is something that sticks out of a bone that muscles are going to attach to. 3, its size matters. Trochanters, tubercles, and tuberosities. All 3 of them are going to have attachment. The biggest one is the trochanter. The smallest one is the tubercle. Now, we are going to look at our femur right here. This is a rounded, bony thing. It is humongous. That is the greater trochanter. This right here is a big, rounded thing. That's the lesser trochanter. By the way, trochanters in humans are only on the femur. This is our medium-sized one. This is a tubercle. This is the greater tubercle. This is the lesser tubercle. They are the medium-sized one. Then the tuberosity, I have dealing with a horrible shadow right here. That is the deltoid tuberosity. So we go humongous on this guy, which is a trochanter, a medium-sized tubercle, and the tuberosity is there. It's very sad and small. And the good news is I'm not going, besides the epicondyle being rounded by a condyle and the process being a bony prominence sticking out of a bone, I am not going to worry about the trochanters, tubercles, or tuberosities. So, one last one is a ramus. A ramus is a flat, straight area. And we have them on the pubic bone, or the pelvic. This is a ramus. This is the inferior pubic ramus. This is the ischial ramus. Can you tell where one ends and the other begins? Neither can I. This over here is the ramus of the mandible. So lastly, we're going to talk about holes. These are passageways for blood vessels, for nerves, and they differ in size. Canals are a passageway, and foramen are a rounded passageway. Usually the only difference between the two is it sounds better. Carotid canal sounds better than carotid foramen. I've seen both. A fissure is what it sounds like, a big, jagged structure. So let's look at a canal, a foramen, and a fissure. We are going to start with the fissure first. See this big, jagged structure right there? Big, jagged structure right there? This jagged structure is a fissure. Now I've turned the bone a little bit sideways. That round structure I'm putting the pipe cleaner in is a canal. That's the optic canal. I have seen optic foramen as well. So again, optic canal just sounds better, so it's a canal, not a foramen. Then we have these ovals. They look just like the canals, but they're foramen. This is the foramen ovale, this is the foramen spinosum, and this is the foramen rotundum. So they are, both canals and foramen are circular openings, and I swear it's just canal sounds better for optic canal and optic foramen and carotid canal than foramens. So have I scared you with these? I didn't mean to. What I care about right now are which ones are landmarks that attach muscles and ligaments, which ones are articulating, that's where two bones come together, and which ones are holes that nerves pass through. I might, because this is an online class, go into a little bit more detail on them on the test, on the study guide, but I wanted just general idea of what they are, not you need to know the names of all the ones I gave you. We have 2 full lectures to learn all those names and 372 more. So right now focus on which ones are articulating, which ones are holes for nerves and blood vessels, and which ones are for muscle and ligament attachment. Thank you.